Leg weakness doesn't shout, it whispers. And if we miss those whispers, the consequences grow louder. That's why these next few minutes are vital. Today, I'll guide you through 7 signs in seniors that show their legs are becoming weak, based strictly on clinical research and practical testing tools. These aren't guesses. They're red flags you can identify early and act upon. So take a seat, or better yet, stand if you're able, and let's begin. And before we dive in, if you're finding this kind of wisdom useful, go ahead and like this video and subscribe so we can keep delivering clarity where it counts. Let's start with one of the clearest indicators of hidden leg weakness: slowed gait speed. Most folks don't think twice about how fast they walk. But science has shown that when a person's self-selected walking speed dips below 0.8 meters per second, it becomes a warning light on the dashboard of their physical health. Why does this matter? Because your walking speed isn't just about your legs. It's about your coordination, your balance, your strength, and even your brain function. When all systems are go, your body moves efficiently. But when muscle fibers start losing their spark, when sarcopenia, the age-related loss of muscle mass, begins its silent work, that speed starts to decline. A 4-meter walk test is often used in clinical settings. You simply measure how long it takes to walk 13 feet at your natural pace. No need to rush or perform. Just walk as if you're crossing the living room. A healthy speed lands above 0.8 meters per second. Anything below that, and it's time to take note. This isn't just about falling. Research shows that slower gait speeds predict higher chances of hospitalization, loss of independence, and even mortality. It's that serious. Take Bill, a retired carpenter. After his wife noticed he wasn't keeping pace during their evening strolls, he got checked. His gait speed had dropped to 0.72. It didn't feel like much to him, but his doctor started him on a structured resistance program and vitamin D supplementation. 6 months later, Bill was back at 0.9 meters per second and feeling more confident on his feet. If you or someone you love is moving slower than usual, don't chalk it up to just getting older. This might be your first clue. The body speaks. We just have to learn its language. Next, impaired sit-to-stand performance, chair rise difficulty. Now, let's turn our attention to a simple yet revealing challenge: rising from a chair. We call this the 30-second sit-to-stand test, and it speaks volumes about the power in your lower limbs. Here's how it works. Sit tall in a standard chair, feet planted firmly on the floor, arms folded across your chest. When you hear go, stand up fully and sit back down as many times as you safely can in 30 seconds. No hands to assist. Count each complete rise. Why this matters: standing up demands strength from your quadriceps, glutes, and core. If you manage fewer than 12 full rises, it suggests those muscles are losing their edge. That weakness silently undermines your ability to climb stairs, recover from stumbles, or simply stand up after a meal. Consider Ruth, 78 years young. She noticed she was bracing herself on the armrests more often. When she tried this test, she only managed 8 rises and felt her legs shake afterward. That moment of revelation prompted her to begin a guided strength program focused on controlled chair stands and light resistance bands. Within weeks, her count climbed toward 12, and she regained confidence moving around her home unassisted. This test isn't about perfection, it's about awareness. If performing 12 rises in 30 seconds feels out of reach, that's your cue to take action. Consult a physical therapist, explore gentle resistance exercises, or simply practice controlled sit-to-stands at home. Strengthening those muscles now lays the groundwork for steadier steps tomorrow. Now let's take a look at something a bit more specific: hip abductor weakness, revealed through what's known as the Trendelenburg sign. To observe this, simply ask the person to stand on one leg for a few seconds, preferably with support nearby, just in case. Watch the level of the pelvis closely. If the pelvis drops on the side that is not bearing weight, it's a positive Trendelenburg sign. That drop signals that the hip abductors, particularly the gluteus medius, are not doing their job of stabilizing the pelvis. Why does this matter? Because weak hip abductors throw off your balance during walking, especially when you lift one foot off the ground. With every step, the muscles of the standing leg are supposed to keep your pelvis steady and your trunk upright. When those muscles falter, your gait changes, becomes unstable, sometimes even waddling. This instability places more strain on your knees, lower back, and ankles, and increases your chance of falling. A positive Trendelenburg sign often shows up before a person notices trouble walking. It's subtle but meaningful, and if it goes unaddressed, it can lead to altered mechanics, joint pain, and reduced mobility. Fortunately, this isn't irreversible. Identifying it early allows for targeted hip-strengthening interventions such as side-lying leg lifts, standing hip abductions, or even basic balance drills like supported single-leg stands. The goal is not just to correct the sign, but to reclaim pelvic control, balance, and confidence while walking. Next, history of frequent tripping or near falls. These aren't full-blown falls, mind you. Not the kind that send you to the emergency room. We're talking about those sudden stumbles, catching your toe on a rug, feeling your balance sway for no reason, needing to grab onto furniture or a wall to stay upright. When these moments start happening more often, they are not random. They are signals. Early, cautious whispers from the body that your legs are losing their responsiveness, coordination, or strength. You see, every step you take relies on the smooth coordination between your brain, nerves, and leg muscles. When any part of that system slows down or weakens, your ability to quickly adjust and recover from a misstep decreases. And that's when a trip becomes a near fall, or worse, an actual fall. Research has shown that individuals who report 2 or more near falls in a 6-month period have a significantly higher risk of future injury from real falls. It's a red flag, plain and simple. Why does this happen? Often it's a combination of subtle leg weakness, diminished proprioception, your body's ability to sense its position, or slowed reflexes. You might notice you're catching your foot on thresholds more often, misjudging distances when stepping, or hesitating when turning corners. This is not something to ignore or accept as part of aging. It's a chance to act. Tracking how often you trip or stumble, yes, even those you recover from, helps you and your care provider assess leg function before a dangerous fall occurs. Simple steps like removing loose rugs, improving lighting, wearing supportive footwear, and incorporating leg strengthening routines can help reduce these events. More advanced interventions may include balance training, Tai Chi, or working with a physical therapist. Listen closely to the quiet cues of your body. If you're tripping more, don't wait until the fall tells the story. 5. Difficulty climbing stairs. Now let's focus on a task that often reveals hidden weakness before any test does: climbing stairs. Stairs are nature's strength detector. Going up demands power from the quadriceps, glutes, and calves. Coming down tests your control, balance, and joint stability. If walking across a room is like cruising on level ground, stairs are the uphill battle that exposes what's happening beneath the surface. Difficulty climbing stairs shows up in a few ways. You might notice that you need to grip the railing more tightly, pause halfway up a flight, or push heavily through one leg more than the other. Perhaps one knee buckles slightly, or you feel a burning fatigue in your thighs after just a few steps. This isn't about aging. This is about functional reserve, the capacity your legs have to perform when challenged. Stair difficulty often means that reserve is thinning. It suggests a loss of eccentric muscle control, your ability to lower yourself down smoothly, as well as a drop in the force output needed to propel yourself upward. Why does it matter? Because when stair climbing becomes hard, everyday life narrows. You begin avoiding steps, choosing elevators even for a floor or two, or restricting movement within your own home. That avoidance accelerates further muscle loss, creating a spiral into frailty. There's also a safety concern. A misstep on stairs, especially when the legs are tired or unresponsive, carries far more risk than a stumble on flat ground. You can test yourself easily. Try ascending a standard staircase, one flight, and observe. How many breaks do you need? Do you use both legs equally? Does one leg feel unreliable? How long before fatigue sets in? These clues matter. To regain stair strength, start with step-ups on a low platform, controlled eccentric lowering, and gradually build intensity with supervision if needed. Strength begets confidence, and confidence keeps you climbing. 6. Noticeable atrophy in lower limb muscles. This next sign doesn't whisper, it shows. You just have to know where to look. When your legs begin to weaken, the muscles themselves start to shrink, not from lack of food, but from disuse. This physical thinning is called atrophy, and it's particularly noticeable in the calves and thighs, where the muscle mass is easiest to monitor with the naked eye or a measuring tape. You might observe that one leg looks smaller than the other, or that pants feel looser around the thighs, even though your weight hasn't changed. For those who've always had strong legs, this kind of visual shift can be unsettling, but it's also extremely informative. What causes this loss? As we age, the body naturally sheds muscle tissue, a process known as sarcopenia, but inactivity, illness, or joint pain can accelerate that decline drastically. If a leg has been favoring an old injury, or if stairs and long walks have been avoided due to fatigue, the muscle begins to shrink in size and power. And here's the concern. Once muscle atrophy begins, the threshold to weakness drops. Everyday tasks, standing from a couch, lifting groceries, walking a block, begin to tax the body more heavily. Weak legs can't absorb shock or stabilize joints properly, which increases strain on the knees and hips. Eventually, the decline becomes visible not just in shape, but in function. Checking for atrophy is simple. Measure around the thickest part of the mid-thigh and mid-calf on both legs. Differences of more than 1-2 centimeters may indicate imbalances or wasting. Even without tools, visual symmetry and feel can guide you. The solution? Consistent, low-impact resistance training. Even light exercises using your body weight can stimulate regrowth. The key is intention, regular movement with purpose before the loss becomes irreversible. Now we come to the final and perhaps the most telling sign: early fatigue during walking. This isn't the kind of tired you feel after a long day out. No, this is fatigue that creeps in quickly, sometimes just a few minutes into a short stroll down the block or a lap around the grocery store. Legs grow heavy, steps become shorter, and an urge to stop and rest surfaces sooner than it should. This type of fatigue signals that your muscle endurance, the ability of your legs to sustain activity over time, is beginning to decline. It's not just about strength anymore. It's about how long your muscles can do the work before quitting on you. Why does this happen? As leg muscles weaken, they must work harder to perform the same basic tasks. That extra effort demands more oxygen and energy. Over time, when those reserves can't keep up, the muscles begin to give way, resulting in premature fatigue and, in some cases, instability. Often, the fatigue is paired with subtle signs like a dragging foot, frequent pauses, or leaning on nearby surfaces for support. These aren't just minor inconveniences, they're red flags that your mobility window is narrowing. The danger here isn't just discomfort, it's retreat. The less confident a person feels in their legs, the more they begin to avoid walking altogether. And once that avoidance sets in, muscle decline accelerates like a snowball rolling downhill. Combating this involves rebuilding muscle stamina with short, consistent walking sessions, light aerobic routines, and gradual progression in both time and intensity. Even walking 10 minutes a day with breaks, then increasing by a minute each week, can reignite that endurance. Don't ignore early fatigue. It's your legs asking for help before they reach the point of surrender. You've now seen the 7 quiet signals that tell us when our legs are beginning to lose their power. Not all at once, but step by step. These signs, taken seriously, can make the difference between dependence and independence, between confidence and hesitation. It's never too early or too late to act. Awareness is the first tool, strength is the next. And remember this, every strong stride begins with a single honest assessment. Keep watching, keep moving, and keep listening to your body. You've earned the right to walk tall. Let's make sure you stay that way.